Infectious Diseases, Preventive Medicine and Clinical Species Conferences 3, 2024-2025. Fish, Crustaceans, Mollusks, Amphibians and Insect Diseases CURS 8. The first part. Infection by the epizootic hematopoietic necrosis virus. Etiological agent, family Iridoviridae, genus Ranavirus. Common name, epizootic hematopoietic necrosis virus, HN. Iridovirids are large viruses with segmented double-stranded DNA. Ranavirus, epizootic hematopoietic necrosis virus, ENVV. Ranaviruses are the agents of systemic infections of fishes, amphibians and reptiles. Of the 6 viral species listed, 5 are ichthyopathogenic, and it was VNHE which first drew attention to the pathogenic power of a ranavirus for fish. The epizootic hematopoietic necrosis virus was isolated in Australia from clinical infections of perch Perca fluviatilis. The name given to the virus reflected the lesion caused by the infection, which, at that time, was described as enzootic instead of epizootic. The authors reported an iridovirus-like virus whose morphology was similar to that of frog virus 3, FV3. The mention made of the receptivity of rainbow trout to NHEF infection, associated with its still limited geographical distribution in EU. Belonging to the ranavirus genus, a new fact because the fish iridoviruses at the time were lymphocyst viruses, was then confirmed on antigenic and molecular criteria. Over time, the pathological importance of VNHE appeared confined to Australia to juvenile perch, even if 4 other species could be experimentally infected naturally. 5 other species were gradually identified: European catfish virus from the catfish Ameurus melas, Bola iridovirus, Santicooper ranavirus, frog virus 3 and Singapore group iridovirus, SGIV. The European catfish virus, is represented by 2 strains, one of the same name, the other called European catfish virus Silurus glanis, European sheetfish virus. It is certain that for the first there are several strains, and this situation is likely for the second. The catfish virus was revealed during 100% lethal hemorrhagic infections occurring respectively in Germany in catfish, and in France in catfish. Biochemically and antigenically, the 2 strains were similar to NHEF and FV3. Bola iridovirus is a virus isolated from the frog Limnodinastes ornatus in Australia, which has been experimentally demonstrated to be pathogenic for the barramundi lates calcarifer. Thus, an amphibian virus could cause a disease in a fish, with the consequences that the fact implied for health legislation. The frog virus 3 is a species of ranavirus comprising a majority of strains originating from amphibians. However, some of these strains originate from sympatric fish and amphibians living in California's Redwood Park. These are Redwood Park virus, stickleback virus, and tadpole virus 2, originating from Rana aurora tadpoles. Here again, the receptivity of fish and amphibians to the same virus was proven. The Santicooper ranavirus takes its name from a lake in South Carolina, site of origin of the black base Micropterus samides, which provided viral isolates. The strains listed by the committee are on the one hand Santicooper ranavirus, largemouth bass virus, LBV, and on the other, the Dr. Fish virus and guppy virus from freshwater ornamental fish and Eclina wrasse from Asia. As a result, the viral species was not only North American, as might have been believed during the initial isolation of LBV, species sensitive to epizootic hematopoietic necrosis, present in the natural environment. Fish can have several common names, but this list only includes just one: natural infection. Perca fluviatilis common perch. Oncorhynchus mycis rainbow trout. Esox lucius. Transmission from one fish to another via contaminated equipment, of contaminated water. Humans can spread epizootic hematopoietic necrosis by moving infected fish, whether alive or dead, contaminated equipment, contaminated water. Epizootic hematopoietic necrosis poses no risk to human health. Clinical and anatomopathological signs. Epizootic hematopoietic necrosis can lead to death. Rainbow trout, after hatching from the eggs, juvenile and adult common perch. Signs that infected fish may show: behavior: loss of appetite, head-down posture, abnormalities in swimming behavior, slowing down of swimming, swimming in spirals. Appearance: abdomen distended, filled with fluid, dark discoloration of the skin, corrosion and thickening of fins, petechiae at the base of the fins, areas of hemorrhage at the gills, numerous white or yellow spots on the liver, pale areas in the muscles, rainbow trout, visceral, muscular and retroocular hemorrhages, exophthalmic and gill discoloration. Catfish: Amphibiurus melas, congestive hemorrhagic lesions accompanying infection with European catfish virus. Amphibiurus melas catfish, ranavirosis, histological section of diseased fish. Images of degeneration and necrosis, arrows, in the interstitium of the middle kidney. Iridoviruses. A. Iridoviruses, VNHE, in a juvenile sturgeon, visible hemorrhages on the head and sides. B. Normal gill of an esturgeon, of which the filaments and lamella can be distinguished. C. Gill of an animal infected with WHSV, the lamella have fused and numerous large cells are observed, arrows. D. The same cells observed at higher magnification, after staining with hematoxylin eosin, which reveals the amphiphilic nature of the cells infected by the virus. E. HEMATOPOIETIC extracted from infected cells, negative staining, electromicroscopy. Diagnostic. Recommended methods for the diagnosis of wire-listed fish disease agents. Confirmation. The immunoperoxidase test, capture ELISA or PCR on cell culture with characteristic cytopathic SN effect or on tissue samples taken from fish. PCR-RIA, restriction endonuclease analysis, PCR sequencing on tissue samples taken from fish. Prophylaxis. Maintenance of disease-free status from epizootic hematopoietic necrosis virus infection. A country, zone or compartment declared free of infection by epizootic hematopoietic necrosis virus may retain its disease-free status with regard to this disease, provided that basic biosafety conditions are maintained at all times. A country, zone or compartment declared free of infection with epizootic hematopoietic necrosis virus may discontinue targeted surveillance while maintaining its disease-free status with regard to that disease, provided that conditions are consistently favorable to the clinical expression of infection with epizootic hematopoietic necrosis virus. However, in areas or compartments declared free of epizootic hematopoietic necrosis in countries which are not infected, as well as in all cases where conditions are not conducive to the clinical expression of infection with epizootic hematopoietic necrosis virus, targeted surveillance shall be continued at a level defined by the Aquatic Animal Health Service in relation to the probability of introduction of the infection. At present, there is no treatment, no vaccine for epizootic hematopoietic necrosis. These alphaviruses are respectively responsible for infections, causing trophic disorders, pancreatic disease in Atlantic salmon reared in the sea, and sleeping sickness in rainbow trout in freshwater. The viral names result: 1. Salmon pancreas disease virus, SPDV, 2. Trout sleeping sickness virus, SVD. In fact, it now appears that Atlantic salmon, brown trout and rainbow trout are susceptible to each of these viruses. Due to the significant economic losses it causes, pancreatic disease was included in 2007 on List B of reportable diseases by the Norwegian Food Safety Authority. Several inactivated vaccines, both monovalent and multivalent, are currently marketed to control this disease. Laboratory tests suggest that SAV would survive for long periods of time in the aquatic environment. The survival of the virus was inversely proportional to temperature. These salmonid alphaviruses are considered atypical with regard to the genus ALPHAVIRUS. Their transmission does not require arthropod vectors. SPDV and SDV viruses belong to the same serotype. In contrast, the use of monoclonal antibodies shows antigenic differences between the two viruses. Atlantic salmon and rainbow trout are the species most likely to be infected with SDV. Experimental studies have demonstrated that all life stages are susceptible to infection. SDV1 to SDV6 were detected in Atlantic salmon. SDV1, SDV2 and SDV3 were detected in rainbow trout. Distribution of the pathogen in the host. The heart and pancreas are the main target organs for VAS infection. Exocrine pancreatic tissue necrosis, myocarditis, and skeletal myositis are typical histopathological signs. In the viremic stage, substantial amounts of virus are also present in the serum, and during infection, the virus can also be found in the brain, kidneys, spleen, gills, mucous membranes, and stool. Carriers. There is evidence that some survivors of outbreaks will become long-term carriers of the virus, and therefore farmed Atlantic salmon and rainbow trout can be considered the main reservoir of SDV. Infection with SDV has been detected in some wild flatfish species in Scotland, which could also serve as a reservoir of infection. Transmission. Horizontal transmission of SDV is demonstrated, spread by water currents. Long-distance transmission of SDV in a previously uninfected area is most likely due to the movement of infected live fish. SDV has been detected in fat leakage from dead fish that accumulates on the surface of seawater, contributing to the spread of the virus through water currents. Once SDV is introduced into an area, the proximity of farms and water currents influence local transmission. The vertical transmission of the SDV is negligible. Vectors. Vectoring transmission of the after-sales service has not yet been demonstrated. Mortality rates due to VAS infection can vary depending on the genotype, season, year, use of biosecurity measures, and fish species. Cumulative mortality at the farm level ranges from negligible to more than 50% in severe cases. The duration of epidemics, defined as the period of increased mortality, can vary from 1 to 32 weeks. The prevalence of VAS infection varies. During epidemics, the prevalence is usually high, 70 to 100%. Geographical distribution. Infection with VAS has been reported in several countries in Europe. Pancreatic disease was first reported in 1976 in Scotland. Later, a similar disease was reported in Atlantic salmon in North America, Norway, France, and Spain. Sleeping sickness is endemic in certain regions of France, and has been observed for many years in Italy. More recently, has been reported in England, Scotland, and Spain. Clinical and anatomopathological manifestations. A sudden drop in appetite may be observed 1 to 2 weeks before high mortality is detected. Clinically ill fish can be observed swimming slowly on the surface of the water. In some cases, extremely weak, sleepy, fish can be found at the bottom of tanks or in net cages. An increase in the number of fecal flows can also be observed. However, it is important to note that the clinical signs are not pathognomonic. Initially, nutritional status is usually normal, but in the months following an outbreak or in the later stages of the disease, long, slender fish, runts, with poor body condition are usually observed. However, the presence of long, slender fish can be caused by other factors than after-sales service. Yellow mucoid intestinal contents are a common post-mortem finding, usually seen in diseased fish. From time to time, signs of circulatory disorders, such as petechial hemorrhages, slight ascites or redness of the pancreatic region between the pyloric checker may be observed. Some fish may have a pale or broken heart. It is important to note that post-mortem results are not pathognomonic. Normal, A, and affected, B, Atlantic salmon of the same age. O, mycis, rainbow trout, infectious pancreatic necrosis. Signs of gastroenteritis, gastric swelling and mucosal fecal discharge in the lower fry that has just succumbed to the infection. The other fry is normal. Pancreas of fish with PD with extensive acinar necrosis on the left and less affected tissues on the right. Salmo trutta, here in marine farming. SALMONID ALPHAVIRUS. Visceral congestion in the pyloric region. S. Trutta, common trout, histological section in the pyloric region of the preceding fish. almost generalized necrotizing pancreatitis, only a few pancreatocytes remain. S. Solar Atlantic salmon, pancreatic disease. Difference in height recorded within the same cohort between a healthy subject weighing about 2 kg and a clinically affected subject weighing about 0.7 kg. O. Mycis, rainbow trout, sleeping sickness. Clinical signs during experimental infection, lateral decubitus of the patients who are piled up on the bottom one on top of the others, even in natural disease. O. Mycis, rainbow trout, lesions. Evolution of sleeping sickness observed on samples taken at 1-week intervals. A. Foci of necrotizing pancreatitis. B. Degeneration of cardiac myoblasts, arrows. C. Degeneration and disintegration of the elements of the red muscle, arrows, infiltrated by mononuclear cells. A. Acipensa transmontanus, white sturgeon. Thinness caused by adenoviruses in a juvenile sturgeon. B. Histological section of the small intestine of a subject suffering from adenoviruses revealing several abnormally large nuclei visible in the mucosa, arrows. C. At higher magnification, note the large cells, with very large nuclei strongly colored, arrows. D. Numerous viral particles observed in electronic section in the nuclei of infected cells. Choice of diagnostic methods, according to the evolution of the infectious load and the humoral response. We note that in the acute phases of the disease, confirmation of the diagnosis is made by methods that highlight the virus or its genetic material, culture, histology or PCR, while in the chronic forms confirmation is made by histological highlighting of the lesions or highlighting the restructuring immunological by serology. Pancreatic disease, PD. The first clinical signs are an increase in appetite before a sudden drop in appetite which indicates acute PD. However, these signs are not always present or observed. A few weeks later, abnormal swimming behavior and increased mortality are usually observed, indicating a chronic phase of the disease. PD tends to reproduce in affected sites and regions. At necropsy, yellow mucus in the intestine is a common finding, but it can also be seen in fish that have not eaten for a variety of reasons. In some fish, fine petechiae in pyloric fat tissue may be observed, resembling acute infectious pancreatic necrosis, APN. Pale and uneven discoloration of the muscle may indicate PD-related pathology. Slender fish, orniths, are often found 1 to several months after the onset of mortality, when the majority of surviving fish generally appear to be clinically healthy. Histopathology remains the basic method used to identify PD, and to differentiate PD from similar diseases. PD is a disease that develops slowly and the characteristic lesions of the different tissues of the same fish do not develop simultaneously. Therefore, different patterns of lesions characterize the different stages of PD. To detect SPDV in tissue sections, an immunohistochemical procedure was established, using a monoclonal antibody directed against glycoprotein E1 as the primary antibody. It detects SPDV in acute pancreatic necrosis and can therefore be used to differentiate PD from acute NPI. However, this method does not identify SPDV in PD-related lesions in subacute and late PD and is therefore of limited use. A rapid viral neutralization assay for the detection of specific antibodies to SPDV in blood samples has been developed. The test has been used for the examination of large numbers of farmed and wild salmonids and is a reliable method to confirm that fish have been exposed to POs and FTS. Viral detection in cell culture by inoculation of tissue homogenates from diseased fish has been difficult, and requires considerable experience in detecting the cytopathic effects, CPE, of VAS in cell culture. Protocols for the detection of SPDV by reverse transcription polymerase chain reaction, RT-PCR, have been established in several laboratories. The selection of primers will depend on whether or not it is necessary to identify all or only one genotypes of the virus. Diagnostic tests for sleeping sickness, DS, are in principle similar to those for PD, with minor modifications. The main clinical sign is the detection of fish sleeping at the bottom of the tank. Histopathological lesions are similar to those of PD. By immunohistochemistry, SDV can be detected in acute pancreatic lesions and muscle lesions in chronically ill fish, indicating that immunohistochemical methods may merit further investigation. Methods for the detection of anti-SDV antibodies and the detection of SDV by RT-PCR and cell culture have also been established. Differential diagnosis. There are a number of economically important conditions in Atlantic salmon that share similar pathological lesions with PD. Infectious pancreatic necrosis, IPN, caused by burnavirus can cause significant pancreatic lesions similar to PD, but can be easily distinguished from PD by the absence of cardiac and muscle lesions and the presence of catarrhal enteritis and liver damage in freshwater and marine salmonids. Cardiomyopathy syndrome, CMS, a condition of unknown etiology of Atlantic salmon reared in seawater, has been recorded in Norway and Scotland. It is a chronic, progressive heart disease associated with sudden heart failure. Severe myocardial degeneration of the atrium and cancellous ventricular muscle is characteristic of this condition, and similar lesions have been observed in severe cases of PD. A condition known as inflammation of the heart and skeletal muscles, HSMI, has been described in Norway and Scotland. In this condition, lesions of the cardiac and skeletal muscles that are histologically very similar to PD have been described in field and experimental studies. The etiologies of CMS and HSMI are not known at this time. Vaccination. Both DNA and inactivated virus cell culture-based vaccines against VAS are available. Based on field observations showing that fish surviving SAV infections were resistant to reinfection, it was suggested that vaccination could be applied for the control of PD and PD. There are a few commercial PD vaccines. The PD vaccine produced by Pharmac, Norway, and the monovalent Norvax Compact PD, NCPD, vaccine, MSD Animal Health, Norway, are based on an inactivated PD virus. Multivalent vaccines, the 3-component Aquavac PD3 in Ireland and Scotland and the 7-component Aquavac PD7 in Norway, have been commercially available since 2015 and are also based on inactivated viruses. Norvax Compact PD, a reduction in mortality of at least 50% is claimed compared to vaccinated fish compared to unvaccinated fish on the same farm. Intervet Norbio showed a reduction in histopathological damages. It has been used in Norwegian salmon aquaculture since 2007. Infectious hematopoietic necrosis virus, IHNV, is a rhabdovirosis that can be responsible for significant mortalities in salmon farming. At the national level, it is classified as a Category 1 hazard. The first symptoms are the development of severe exophthalmia, followed by pallor of the gills. The internal organs show severe hemorrhages and the hematopoietic organs necrotic lesions. There is currently no vaccine response, the only attitude being the disinfection of aquaculture facilities. The estimated annual cost of production losses is €23 million, representing about a fifth of the annual trout production. The virus did indeed constitute 3 genetic groups designated as 1, 2 and 3, which became respectively U, upper, M, medium, and L, lower, in reference to their north-south positioning in the northwestern American distribution area of the virus. The viruses of these genogroups have sockeye salmon, rainbow trout and Chinook salmon as preferred host species, respectively, as initially appeared when the geographical origin of the viral strains was linked to their susceptible host species. Nevertheless, the viral strains of each genogroup are capable of infecting a dozen species of salmonids at varying degrees of severity, demonstrating that there is a preference rather than a specificity of hosts. The qualitative influence of the pathogen's genome on its receptive hosts could therefore be quantitatively modulated by their receptivity, under the control of their own genome. Genetic diversity is found among European strains. The IHN virus, present in France and Europe, belongs to the M group. In terms of official health prophylaxis, IHNV is a homogeneous set of viral strains, both in terms of susceptible species and antigenicity. A good immune serum, specific to a strain of one of the genogroups, recognizes all strains, neutralization, fluorescence, ELISA. It is therefore easy to establish an unequivocal qualification with regard to the HNV entity, all of whose isolates are pathogenic to varying degrees for several species of salmonids, but not for representatives of other fish families. Clinical and anatomopathological manifestations. The disease is generally characterized by a sudden increase in mortality in the absence of detectable lesions. Diseased fish show clinical signs, lethargy with bouts of hyperactivity, melanosis, anemic gills, ascites, dilated abdomen, exophthalmos, and internal and external petechiae. Juveniles less than 6 months of age are most susceptible to IHN. O. NECROSIS salmon, infectious hematopoietic necrosis, IHN. This is one of the first cases observed in the northwest of the North American continent. Note exophthalmia, the tendency to bloat and the appearance of hemorrhages in the anal region. O. NECROSIS, subadult sockeye salmon, NHI. Punctiform visceral hemorrhages accompanied by ascites, arrow, Esox lucius pike. Hemorrhages forming the myocepts during an experimental infection with perch rhabdovirus. The top fish is healthy. This type of lesion is shared by young subjects of all species in viruses with congestive and hemorrhagic manifestations. The official method of confirming the presence of IHNV in fish tissues or their biological fluids, ovarian or seminal fluid, has for a long time been based on a phase of culture of the samples collected on adapted cell lines, followed, in the event of visualization of cytopathic effects, PFE. Identification by immunofluorescence, seroneutralization, ELISA, or by molecular methods. Prophylaxis. Among each fish species, there is a high degree of variation in sensitivity to IHN. The age of the fish is extremely important. The younger the fish, the more predisposed they are to the disease. As with the viral hemorrhagic septicemia virus, the overall good health of the fish appears to decrease the overt susceptibility to IHN. Fish are increasingly resistant to infection, will become asymptomatic carriers. The water supply must be virus-free. The health status of fish must be controlled, in particular when they are introduced both into the fish farm or into the catchment area of the fish farm, and in particular when eggs are introduced. Aquaculture farms or aquaculture areas can obtain disease-free status after the implementation of a qualification program and subject to compliance with the strict and specific measures of the qualification. Maintenance of infection-free from infectious hematopoietic necrosis virus. A country, zone or compartment declared free from infection by infectious hematopoietic necrosis virus, in accordance with the provisions laid down, may maintain its disease-free status with regard to that infection, provided that basic biosafety conditions are maintained at all times. A country, zone or compartment declared free of infection with infectious hematopoietic necrosis virus may discontinue targeted surveillance, while maintaining its disease-free status with regard to that infection, provided that conditions conducive to the clinical expression of infection with infectious hematopoietic necrosis virus are present. However, in areas or compartments declared free of infection by infectious hematopoietic necrosis virus and located in the territory of infected countries, as well as in all cases where conditions are not conducive to the clinical expression of infection with infectious hematopoietic necrosis virus, targeted surveillance shall be continued at a level defined by the Aquatic Animal Health Service in relation to the likelihood of introduction of the infection. Spring carp viremia, SVC, is an acute, systemic, contagious disease caused by a rhabdovirus, which mainly affects common carp. Several other cyprinids and a few other species are also susceptible. Spring viremia of carp usually occurs at water temperatures below 18 degrees Celsius, and mainly in the spring. The name of the virus approved by the International Committee on Taxonomy of Viruses is the spring viremia virus of carp, SVCV, and it is classified as a provisional species in the genus Vesiculovirus of the viral family Rhabdoviridae. In recent years, however, the range of the disease has spread to countries in North and South America and Asia. Economical impact. Spring viremia of CARP virus can lead to significant mortality and economic losses that fluctuate from year to year. These irregularities in epizootic patterns are poorly understood. Mortality is usually around 30%, but can exceed 70%. Most outbreaks occur after ponds are restocked in the spring. Estimated the loss of yearling carp in Europe at 4,000 tons per year, or 10 to 15% of this age group. The loss is more disastrous when 2-year-old carp are used for restocking. The need for restocking increases the cost of production. Carp is the main species affected by SCV. The 4 varieties with scaled distribution as well as koi can be infected. Wild carp were more sensitive to VSC than farmed carp. Young fish and adults are susceptible to the virus. Due to the seasonality of the disease, the main age groups affected are 9 to 12 and 21 to 24 months. Although the majority of SCV cases occur in farmed carp, the disease also occurs in wild carp. As in almost all fish diseases, temperature is the main factor determining the course and outcome of SVC infection. The disease does not develop in infected fish kept at 20 to 22 degrees Celsius or higher. The SCV can be expected from November to July, with a peak in April to June. Tropical and subtropical climates are unfavorable to the development of SVC. The age of the fish influences resistance to CVS. Juvenile fish were susceptible and that fish 1.5 years of age were resistant. Catfish up to 25 days old are susceptible, but older fish become resistant. Farmed carp are more sensitive than grass carp, which in turn are more susceptible than the bighead hybrid times silver carp. Field observations indicate that overcrowding of fry in winter or spring and long transport before stocking promote epidemics and high mortalities. The physiological state of the fish, the quality of the water and the stress of handling also influence the course and outcome of the infection. Spring viremia of carp has been diagnosed in countries with low water temperatures during the winter. Serological surveys have shown that antibodies neutralizing the virus have been found in 95% of carp farms in those countries. Spring viremia of carp is usually transmitted horizontally. Virus from the shedding of openly infected fish in fecal feces and possibly in urine and gill mucus. Evidence of a persistent viremic phase in experimentally maintained infected carp at temperatures below 13 to 14 degrees Celsius suggests that the shedding of SCV by a few fish during the winter is the most important factor of transmission. Shedding of the virus by survivors of infection has not been demonstrated but appears to be important for the survival of the virus in fish populations. The virus likely circulates from the farm to open water and vice versa through small wild and farmed fish escaping, as well as through water drainage and pond filling. Blood-sucking parasites, such as the carp lice, Argillus foliaceus, and the leech, Piscicola geometra, are vectors and can transfer the virus from infected carp to healthy carp. They do not support replication or long-term survival of the virus. Piscivorous birds can probably carry the virus. Infected fish regurgitated from herons, Ardea cinerea, fed with SCV contained the virus for up to 120 minutes after being fed. Under experimental conditions, SVCV could be transmitted to pike by predation. Since SCV retains its infectivity for a long time in water, mud or in a dry state, the pond environment and fishing gear of SVCV-positive farms should be considered to be infected with the virus. The gills are the natural gateway for the virus and its primary replication. Entry through the intestinal route seems to be of minor importance. Vertical transmission of the VCS seems possible, with minor importance. Signs and lesions. The multiplication of the virus in the capillary endothelium, as well as in the hematopoietic and excretory renal tissues, causes an alteration of the fluid balance, which is often fatal. Characteristic gross lesions include edema, hemorrhage, anemia, enteritis, and peritonitis. Mixed and secondary infections may result in additional clinical signs and increased mortality. Fish in the early stages of the disease congregate where water flow is slow and near pond banks or are at the bottom. Breathing rate, response to sensory stimulation, and swimming speed are gradually reduced. In the terminal phase, fish are lazy, swim sideways, move slowly and aimlessly, or rest in a normal or abnormal position. External signs of SCV include darkening of the skin, swollen belly, exophthalmos, petechial hemorrhage and bruising in the skin, gills, and anterior eye chamber, anemia and pale gills, and protrusion and inflammation of the blowhole. Excretion of long, white to yellowish, thick mucoid castings from the blowhole is readily visible in fish preserved in experimental facilities. Internal signs are dominated by all-organ edema, hemorrhage, peritonitis, and catarrhal enteritis. Small to large amounts of a clear fluid in the peritoneal cavity may be tinged with blood. Fibrinous peritonitis causes adhesions of the organs to each other and to the parietal peritoneum. Petechial hemorrhage is evident in the internal organs and muscles. The hemorrhage is easily recognized in the epithelial lamina of the swim bladder. The intestine is empty of food and appears stretched from the abundant mucus. The spleen is enlarged and sometimes affected by hemorrhagic or ischemic infarctions. After infection by immersion, the virus was detectable in the gills up to 2, and then on the 4th day, at 13 degrees Celsius, when it was also present in the kidneys, liver, spleen and intestine. Viremia was evident on day 5 and the virus was detected in the feces on day 11. High viral titers in the kidneys, liver, and spleen of infected CARPs indicate that these organs are the primary targets for virus replication. Reduction in hematocrit and hemoglobin demonstrated in infected catfish is a consequence of damage to the hematopoietic tissue. Necrosis at this and other sites is accompanied by an increase in blood transaminase activity. Histopathological changes in some experimentally infected CARP organs have been described. The blood vessels in the liver have a variable degree of edematous perivascularitis, which leads to necrosis. The hepatic parenchyma is hyperemic, with multiple focal necroses and degeneration. The pancreas is inflamed and has multifocal necrosis. The hyperemic spleen shows hyperplasia of the reticuloendothelium and hypertrophy of the melanomacrophagous centers. In the kidney, both excretory and hematopoietic tissue are damaged. The tubules are obstructed by plasters and the cells undergo hyaline degeneration and vacuolization. The peritoneum is inflamed and the lymphatic vessels are filled with detritus and macrophages. Changes in the intestine are dominated by perivascular inflammation, desquamation of the epithelium, and atrophy of the villi. In the swim bladder, the epithelial lamina changes from a monolayer to a discontinuous multilayer. The vessels of its submucosa are dilated, while lymphocytes infiltrate nearby areas. The heart has pericarditis and myocardial infiltration, which is accompanied by focal degeneration and necrosis. They also noted encephalitis, hemorrhage and inflammation of the spleen, as well as acute catarrhal enteritis, with necrosis and desquamation of the epithelium. Saprinus carpio, common carp. Spring viremia. Congestion and hemorrhages in the vicinity of the shoulder girdle, exophthalmos, and dilation due to the presence of ascites fluid. Mortality of fry and older fish can be expected at temperatures below 18 to 20 degrees Celsius, i.e., in spring and early summer, but less frequently in autumn and winter. Clinical suspicion is based on behavioral and external and internal signs. Confirmation diagnosis of SCV, ideally, direct diagnosis by IF or ELISA should be confirmed by isolation of the virus followed by a virus neutralization test. At least 10 diseased or moribund fish of each species or group should be selected for laboratory confirmation of SCV in suspected outbreaks. Live or sacrificed specimens are transported under refrigeration or on ice but never frozen. Isolation of SVCV from diseased fish is easily achieved by inoculation of susceptible cell cultures, young, 24 hours, and active with homogenized, decontaminated, clarified and diluted organ samples, 3 dilutions in series 10 times. The identification of isolated viruses is carried out using serological techniques, namely viral neutralization or immunoperoxidase. Neutralization of the virus is the preferred test. Isolation of the virus accompanied by simultaneous viral neutralization of the SVCV accelerates diagnosis. Kits for IFAT and ELISA to identify SCV in cell cultures are commercially available. The spring viremia of CARP virus is serologically distinct from all other fish rhabdoviruses. Identification of SCV by molecular biology methods is more reliable than serology, and these methods have also been used for the direct detection of SVCV in infected fish. Koi herpes virus is an infection by herpes virus, cyprinid 3 herpes virus or CHV3, capable of inducing contagious and acute viremia in common carp and other varieties, such as ornamental koi carp and ghost carp. The disease spreads easily and usually occurs in summer, at water temperatures between 16 degrees Celsius to 25 degrees Celsius. Fish that show clinical signs of disease, they usually die within a few hours. At lower temperatures, fish can carry the virus without obvious signs of infection, leading to difficult identification of the disease. Other related cyprinid species, such as the crucian carp and grasshopper, do not appear to be affected by the disease. The disease can progress rapidly, with an incubation period of 3 days, at high water temperatures, but normally the incubation period lasts between 7 to 21 days. The morbidity of the affected population can reach 100%, with mortality ranging from 70% to 80%, and sometimes even up to 90% to 100%. Etiology. Koi herpes virus has been classified as cyprinid herpes virus CHV3. Order Herpesvirals. Family ALPHAVIRUS. Ictaluravirus. Koi herpes virus infection was first reported in the United States and Israel in 1998 due to widespread mortality in ornamental koi or common carp farms. Since then, many cases have been reported and confirmed in Europe and the United States and later around the world. In the United Kingdom and continental Europe, the virus has caused increased mortality in ornamental fish in sport fishing ponds. KHV is widespread worldwide in ornamental carps. Imports of illegal ornamental koi carp plays an important role in the spread of the disease. Affected organs. The gills, kidneys and spleen are the organs in which the virus is found in abundance during the course of the infection. Epidemiology. The disease occurs at water temperatures between 16 degrees Celsius and 25 degrees Celsius, when at this temperature, acute mortality is observed. At water temperatures below 16 degrees Celsius and above 25 degrees Celsius, the virus can enter the latency phase, and can persist in asymptomatic carrier fish, with a low viral load, at the limit of detection methods. Carrier fish. Asymptomatic carrier fish can eventually synthesize antibodies. They may or may not develop clinical signs of stress or elevated water temperature. An asymptomatic carrier will contaminate a batch of fish, to which it occurs, sometimes after a long time, when the temperature of the water will rise, reaching the range of 16 degrees to 25 degrees Celsius. Transmission of the disease. Horizontal. The disease can be transmitted through direct contact between fish and fish, as the virus is extremely contagious. It is possible that the disease was spread through contaminated water, nets or other equipment. The virus is eliminated through feces, urine, but perhaps also through the gills and skin. The skin is the main gateway, more than the gills. Vertical way. The transmission of the virus by caviar cannot be excluded. The virus that causes koi herpes virus does not cause disease in humans. A recent study has shown that apparently healthy koi carp, carriers/survivors, or other fish species, than Saprinus carpio, can become infectious and therefore able to transmit CHV3 virus to healthy carp. This may explain some unexplained outbreaks of KHV infection. Clinical signs. The clinical signs of koi herpes virus are usually nonspecific. The main clinical sign is severe gill necrosis, caused by viral replication. The gills are affected, showing areas of necrosis, often accompanied by secondary infections caused by bacteria and fungi, which can mask the disease. Other clinical signs are loss of appetite, erratic swimming behavior, lethargy, discoloration or redness of the skin, bleeding on the skin and at the base of swimmers, increased respiratory rate. Scalp discoloration and enophthalmia. During the first phase of the disease, fish may have abundant mucus. Skin lesions end with mucus loss, leading to patches and bleeding. Enophthalmia is also observed. The diagnosis is complicated by various factors, such as the effects of secondary infections caused by bacteria and fungi, which further complicate diagnosis. There are a variety of clinical signs associated with COI herpesvirus. The diagnosis is confirmed on the basis of laboratory methods. Outside the water temperature range between 16 degrees Celsius to 25 degrees Celsius, the fish do not show clinical signs but remain asymptomatic carriers. Diagnosis: dead or dying fish. The PCR test is recommended by the WA for the diagnosis of the disease. Direct methods include PCR techniques, testing for the presence of the KHV genome. Indirect immunofluorescence. Isolation and identification of the virus, viral growth, using cell lines, KFs. Indirect methods include ELISA tests, which detect antibodies produced by fish against the virus. The ELISA can show that the fish has also been exposed or infected with KHV at one time or another. Since indirect tests such as ELISA cannot determine whether the fish is still infected with the virus, the method is not recommended for initial diagnosis. Detection of asymptomatic carriers. PCR methods can detect only some of the asymptomatic carriers. Serological methods based on the detection of antiviral antibodies are not sufficient sensitive and specific at this time. The real challenge today is to detect healthy carriers with very little virus in their blood, but likely to trigger an epizootic. Quantitative PCR can detect a certain number of those fishes, but is not yet 100% reliable. Serological methods based on the search for antivirus antibodies are recommended, but they need to be further improved in terms of sensitivity and specificity for efficient screenings. Given the high risk of introduction of SIF3 into the European territory, with fish regularly produced in other countries, it is relevant for an importer to cross-check different health information concerning the producer, general condition, ELISA and PCR laboratory test certificates on samples, rather than relying on a single method. Differential diagnosis. It is important to differentiate the COI herpes virus infection from infections with other viruses that can cause diseases of common CARP and COI CARP. Other known viral diseases of CARP are spring viremia of CARP, VCS, and smallpox of CARP, CHV1. Measures in case of suspected disease. If the disease is suspected: A. Sampling and review of the NRL for fish diseases in official laboratories. B. Pending the results of the examination provided by the laboratory. I. Holdings where the disease is suspected are subject to appropriate official surveillance and control measures to prevent the spread of the disease. 2. No aquaculture animal is permitted to enter or leave the affected holdings where the disease is suspected unless authorized by the competent authority. 3. The planned epidemiological investigation. The epidemiological investigation must follow: A. Determination of the origin and possible means of contamination. B. If the aquaculture animals have left the holding during the preceding reporting period. C. If other holdings have been infected. When the epizootic investigation shows that the disease has been introduced into a or several farms or open waters, the measures provided for those farms or open waters. In the case of waters in a large river basin or coastal areas, the competent authority may decide to limit the application. In a smaller area near farms suspected of being infected, if it considers that smaller area to be large enough to ensure that the disease does not spread. Where appropriate, the competent authorities of the member states of the neighboring European Union or third countries shall be informed of suspected cases of the disease. If the National Veterinary Health and Food Safety Authority is informed of the occurrence of such a situation in a member state neighboring the European Union, it shall act accordingly for the application of the measures provided for in this article, on the territory of Romania. Treatment. There is no cure for KHV, and any fish with the disease can carry the disease and will be a source of infection. Preventive measures. An effective attenuated vaccine has been produced in Israel, but that vaccine, it is forbidden to use it, in the European Union. A vaccinated fish can remain an asymptomatic carrier of a virulent strain and represent a source of infection. At the same time, the question is, what is the possibility that the viral strain will become much more virulent? Prevention. Quarantine is the best way to avoid introducing KHV into the fish population that has never been in contact with the virus. For effective quarantine, all fish should be kept in separate systems/tanks/pools, ideally in a different area than the resident fish. Resident fish, already on the farm, must be fed and handled prior to the newly introduced, quarantined fish. The equipment used, nets, buckets, etc., for fish in quarantine is not also used for resident fish. In addition, foot sanitizers may be used, and it is recommended to wash the hands of staff entering and leaving the quarantine area. The quarantine period for susceptible species is between 30 and 60 days. The best way to prevent KHV is to obtain it from reliable sources. Monitoring and testing for KHV is performed by laboratory testing. Geno-strain typing. If any pathogen has spread in a host population, it is sometimes useful to trace its origin. If we want to understand the origin of an epizootic, it must trace the course of the incriminated batches and any mixtures of fish. More fundamentally, the few isolated sequencing studies published by various teams show unambiguously that we are dealing with a single virus strain that has spread on a large scale and has embarked on an evolution, by mutations, that will be interesting to follow. Iridoviruses are large viruses with single-segmented double-stranded DNA, figure. Viruses of the Iridoviridae family are the cause of pathologies of major economic importance, but of very different severity. This family includes viruses that cause a mild localized infection, LDV, or a generalized infection, systemic iridovirosis, respectively caused by lymphocystovirus to the Japanese sea bream, and Red Sea bream Pugrus major. Megalocytovirus, the necrotizing infectious splenonephritis virus, a rapidly expanding viral species in tropical fish. Rushf is now the type species of a new genus of iridovirids, responsible for devastating systemic infections in mainly marine tropical fish farms, Southeast Asia, Japan, and Taiwan. The impact of these infections appeared at the end of the 80s, at the same time as their pathological community was taking shape. Cellular cytomegaly with a large cytoplasmic inclusion, a lesion clearly visible in the stained imprints of the kidney or spleen, as well as in the histological sections. This lesion suggested the name megalocytovirus for the genus. Various viral strains of Rushf were isolated from several species of diseased fish. Clinical signs, pathology and epidemiology of Red Sea bream iridovirus. The first outbreak of megalocytovirus-induced disease was recorded in Red Sea bream, Pugrus major, farms in Japan in 1990 and named Red Sea bream iridovirus disease, SISR, by Inoue et al. Since 1991, the disease has caused mass mortalities in more than 30 species of farmed marine fish in the western part of Japan. The disease mainly infects fingerlings, but market-sized fish are also affected. The range of susceptible hosts consists mainly of species of the order Perciformes, but some species belonging to the orders Pleuronectiformes and Tetraodontiformes are also affected. In the case of Rushf in Japan, the disease occurs mainly in summer, a period of high water temperature. Diseased fish are lethargic, swim desperately and have severe anemia, gill petechiae and enlarged spleen with a mortality of 20 to 60%. Histopathology is characterized by the development of enlarged cells in the spleen, heart, kidneys, liver, and gills, Figure 1a, that exhibit basophilic features when stained with Giemsa. These enlarged cells, called inclusion carrier cells, are pathognomonic for SIVD. Giemsa-stained fingerprint smears of the spleen of Red Sea bream infected with RUSH show enlarged cells characterized by basophilic staining. The electron micrograph of splenic cells infected with RUSH. See higher magnification of virions seen in panel B. Diagnosis for SIVD. Analysis of virus-infected cells using Giemsa-stained spleen swipes, Figure 1a, has been commonly used for the rapid diagnosis of RUSH-infected fish. However, this method only offers a presumptive diagnosis and does not confirm the presence of RUSH. Immunofluorescence. Therefore, M10, a monoclonal antibody, was selected and used for the development of an RUSH detection assay. This test can be used, not only with spleen impression smears of infected fish, but also with cell cultures and sections of infected tissue. PCR methods. Other rapid and more sensitive confirmatory diagnostic methods, such as PCR, have also been developed. Figure. Immunofluorescence assay. A. Grunt fin, GF. Cells infected with RUSH were incubated with the M10 monoclonal antibody and bloated, infected cells were identified by the presence of diffuse staining throughout the cell. B. RUSH-infected GF cells were incubated with anti-RUSH rabbit polyclonal serum that detects structural proteins. Vaccination. For the control of Red Sea bream iridovirus SIVD, an effective formalin inactivated vaccine was developed by Nakajima et al. This injectable vaccine is now commercially available in Japan for red grouper bream as well as for fish belonging to the genus Seriola, striped jack, Pseudocoranx dentex, Malabar maru, Epinophilus malabaricus, and orange-spotted grouper, Epinophilus coyodes. This vaccine represents the first viral vaccine for marine fish in the world. Maintaining the status of disease-free country, zone or compartment. Under the provisions, a country, zone or compartment declared free of Japanese sea bream iridoviruses may retain its status as a disease-free country, zone or compartment, provided that the basic biosafety conditions are maintained at all times. However, for areas or compartments declared free of Japanese sea bream iridoviruses, which are located in countries that are infected with the causative agent of the disease, as well as in all cases where the conditions are not conducive to the clinical expression of Japanese sea bream iridoviruses, the specific surveillance procedure shall be continued at a level defined by the competent authority in relation to the likelihood of introduction of the infection. Viral hemorrhagic septicemia (VHS) is a severe disease in farmed rainbow trout, and causes huge losses, every year, in several European countries. They have not been found in wild fish, and the only cases in the marine environment have been associated with rainbow trout, transferred to cages at sea. The rainbow trout had probably already been infected during its life in freshwater, prior to transfer to the marine site. Large isolated mortalities have occurred off the coasts of Denmark and France, but this problem has not yet become widespread. Etiology. VHS virus is, like its cousin IHNV, an oviraptorvirus whose complete genome sequence was established in 1999 from an isolated European strain of rainbow trout. The strains of VHSV are divided into 4 genogroups, whose members infect more than 80 species of marine and freshwater fish clinically or invisibly. Each of the genogroups has a particular host spectrum. For the virus, which was considered unique at the time, 4 serotypes and various antigenic groups that could be differentiated using monoclonal antibodies had been defined, and allowed strain typing. The genetic grouping thus obtained corresponds to differences in the geographical origin of the viral strains, MAP. Group 1 includes, on the one hand, continental freshwater strains and on the other hand, strains derived from marine fish from the Baltic Sea, the North Sea and the English Channel. Group 2 is restricted to a small, relatively deep area of the eastern Baltic. Group 3 found in marine fishes from coastal waters of the United Kingdom and Ireland, is now identified in a fjord in Middle Norway in farmed rainbow trout. Group 4, which was first identified in various fish species from the eastern and western coasts of the North Pacific, later emerged as a subgroup, 4b, among the North American Great Lakes fishes, with the early Group 4 becoming 4a. Finally, within the same subgroup, the geographical segregation of strains can still occur, as demonstrated by the results of a genetic variability study conducted on 63 strains from trout, pike and black bass from various French regions. Epidemiology. The viral hemorrhagic septicemia virus has an extensive distribution in a variety of wild, freshwater, lake, and river fish, and there is growing evidence underway to show that the virus is also prevalent in the marine environment. Transmission. Shedding and transmission of the virus in European countries is thought to have occurred with lateral spread from infected fish farms and development of the carrier state in nearby wild fish. In several European states, reinfection of farmed stocks took place after the eradication of VHS infection in farms. Urinary shedding of clinically infected rainbow trout has been shown to be a means of virus dissemination. Symptoms and lesions. Animals of all ages can be affected, but the disease is more common and more severe in juveniles. The disease most often occurs when the water temperature is between 4 and 14 degrees Celsius. In rainbow trout, the disease presents in 3 varied forms, namely acute, chronic, and nervous, followed by a carrier state in surviving fish, where the virus can be isolated from persistently infected tissues, such as the kidneys and brain. It can present itself in several forms, with different symptoms. Acute form. In the acute stage, from day 0 to day 30, at 8 to 12 degrees Celsius, sick fish are observed lying at the bottom of the tank or moribund, showing pre-acute signs of flash or corkscrew. The fish are listless at the edge of the body of water or pond and have a dark coloration and protruding eyes. The gills are very pale and often dotted with red dots, dot-shaped bleeding. Losses reach up to 50% in the space of a few days. Chronic form. Fish swim in circular motions around the longitudinal axis of their body, have a marked dark coloration, and protruding eyes. The gills have a grayish-whitish discoloration and are sometimes dotted with red dots. This form of disease causes only minimal losses. The chronic stage reflects a long-lasting persistent infection and is not correlated with any obvious external signs. The virus can be isolated from all major internal organs, and the virus has subacute depressant effects on red and white blood cell counts. Nervous shape. Fish swim in very fast, spiral movements. The losses are minimal. In the nervous form, there are very marked aberrations in swimming behavior, i.e., constant blinking, tail chasing and spiraling. Nervous tropism is characteristic of virulent freshwater strains, but can be observed with marine strains, such as that of turbot. Anatomopathology. The most pronounced changes are in the kidneys and liver. The kidneys are swollen and darker red at first, but the head and midsection are often completely necrotic and pale in fry of dead trout. Rainbow trout, Oncorhynchus mycis, fry with clinical VHS, showing exophthalmos and a pale necrotic genus. The liver is paler than normal, yellowish with areas of mottled hemorrhage. Systemic hemorrhage may be evident in the ocular tissues and skin and in the viscera, including the intestinal submucosa and skeletal musculature. There is no food in the gastrointestinal tract and stringy mucus may be seen in the lumen. Histopathological. The viral hemorrhagic septicemia virus is most pathogenic to the kidney, and early necrosis of the hematopoietic tissue rather than the excretory tubules is a marked feature of the disease. Melanomacrophages, distributed at high density throughout the kidney, with the release of granules and necrosis. In rainbow trout, the liver exhibits generalized focal necrosis, degeneration of hepatocyte nuclei, chromatin granulation, and accumulation of hyaline material in the tubular lumen. In other hosts, especially pike fry, there may be extravasation or bloody swelling, deposition of blood in the muscle, and pancreatic necrosis. The hepatic sinusoids become engorged with blood and present generalized necrosis and numerous pycnotic and karyolytic nuclei without other diagnostic inclusions. Numerous foci of erythrocytes occur in the musculature. The heart is also a target organ, and a very marked necrosis of the ventricular fibers has been observed. Heart failure is likely one of the leading causes of death in this benthic species, as the rate of opercular movement increases in moribund turbot infected with VHSV. Cytological aspects of VHS virus infection. Ultrafine sections at electron microscopy. These locations. Intracellular diseases of the virus are an example of the acute evolution of the virus. A. Blood capillary after 3 days of infection, showing virions, arrow, in a degenerative endothelial cell. B. Infection of the myocardium, the virions budding on the surface of a muscle cell. C. Renal interstitial cell degenerating, after 3 days of infection. It appears surrounded by virions budding on its surface and free virions, all of which testify to the intensity of the infection. D. Virions, arrows, emitted in the lumen, 1, of a urinary tubule of the proximal segment and among the microvilli, MV. General signs of a virus, in this case VHS, in a breeding tank. The dead are piling up at the exit gate of the basin. The sick, asthenic with melanism, and are carried away by the current to the exit gate where they die. Death is often preceded by locomotor disorders of helical swimming. Melanism and double exophthalmos during VHS. This exophthalmia is at the origin of the name of big eye disease by fish farmers. Pathogenesis. The viral hemorrhagic septicemia virus enters fish through the gill epithelium and from there rapidly, via the blood, to the major internal organs. There is also evidence that the skin can be a gateway for the virus. By implication, this could also mean that skin cells infected with VHSV are an exit door for the virus. By adhering, penetrating and multiplying in the endothelial cells lining the venules and sinusoids, the virus causes the first degree of pathology of the cells lining the circulatory system, as early as 48 hours after infection. Then, the virus spreads to the head of the kidney and causes cell degeneration and necrosis of the blood-forming cells of the kidney and macrophages and melanomacrophages, starting 2 to 4 days after infection. Then the infection spreads to the liver, 4 days, with necrosis of hepatocytes and, later, necrosis of pancreatic acinar cells, 6 days. Shedding of the virus by carrier fish occurs through the urine on day 3, as shown by experimental infection by bathing rainbow trout. In marine species, turbot, a similar pathogenic pattern occurs. There is hemorrhage on the eye socket and fin edges and marked swelling, due to impaired osmoregulation. The sequence of entry of the virus, via the gills to the bloodstream and from there to the target organs, the kidneys of the head and the liver, is also repeated. Necrosis of target hematopoietic cells rapidly leads to renal dysfunction and morbidity. Immunity. Rainbow trout exposed to the HERPESVIRUS virus that survive the infection develop different types of immunity. Both non-specific, due to interferon, IFN, and specific, due to antibodies, neutralizing and non-neutralizing. Interferon. Experimentally infected rainbow trout produced IFN, and that IFN peaked on day 3, when it could have the most inhibitory effect. Specific antibody. Neutralizing antibodies have been described for trout recovering from VHS infection. Neutralizing antibody responses take a variable amount of time to develop, found that 130 grams trout exposed to the HERPESVIRUS strain, through cohabitation, developed antibodies 4 to 10 weeks later. Temperature plays a profound role in the development of the immune response. Basically, a low temperature of 5 to 10 degrees Celsius was optimal to stimulate a good priming of the immune response. On the other hand, too rapid clearance of the virus at high temperatures, 15 to 20 degrees Celsius, implying the production of IFN, attenuated the antibody response, resulting in a very low antibody titer. Diagnosis. Tissue cultures, a variety of established fish cell lines have been shown to be susceptible to VHSV. Rainbow trout fry, BF2, and gonad cells are the most sensitive cell lines for a virulent freshwater serogroup 1 isolate from rainbow trout and also a serogroup 3 isolate. A partial differential diagnosis of the type of virus can be made depending on the type of plaque. VHSV causes offset edge plates in RTG2 cells, while IPNV causes more regular edged plates. Serology. The virus can be identified by neutralization assay on any of the above susceptible cell lines. This is performed either by a Beach neutralization assay, NTP, or by a microtiter neutralization assay, using a constant dose of virus and variable antiserum dilutions. Antigen capture ELISA is widely used for the detection of viruses in culture supernatants. ELISA is considered to be the most sensitive technique, although different types of antibodies are clearly involved. Immunofluorescent antibody assay IFAT was developed to detect viral antigen in infected tissue cells up to 26 hours after infection. Maximum staining is detected from 18 to 26 hours at the peak of protein synthesis and virus assembly. Viral gene probes. Deoxyribonucleic acid, DNA, probes for VHSV have been developed at the Northwest Biological Science Center, Seattle, USA. The nucleotide sequences of the nucleoprotein gene of the macaque strain of VHV and the virulent French 07-71 strain were determined by Bernard, National Eradication and Surveillance Plan. The objective of the PNES is to qualify the national territory free of HOSFAU and IHN through the establishment of a national system for the prevention, surveillance and control of its diseases. It is the subject of the ministerial decree of the 27th of June 2018, published on the 29th of June 2018 in the Official Journal, specifying the terms and conditions of its planned gradual implementation, according to the needs expressed by the fish farmers. The choice to join these is a voluntary process. Several French regions have already committed to this approach since 2018. The Hauts-de-France, the Grand Est, Bourgogne-Franche-Comté, Centre-Val de Loire and Normandy. The Pays de la Loire region is a small fish farming region in terms of number of companies, a good 20, volume, 500 to 800 t, and turnover, €6 to €10 million. But the main characteristic comes from the very diversified productions with marine fish farming and inland fish farming. These will facilitate the qualification process for large territories by making targeted monitoring of aquaculture farms mandatory. It will also allow the French state to apply for aid under the EMFF, which can be particularly useful in the event of the discovery of outbreaks. Indeed, any outbreaks of VHS and IHN that may be identified during the program will be systematically eliminated and compensated in order to best cover the real financial losses for companies. The Regional Council for the Orientation of Animal and Plant Health Policy, CROPSAVE, must recognize the PNES for its implementation in the Pays de la Loire region, and has take place at the end of 2020. Etiology. This shrimp disease is caused by the yellowhead virus, YHV, a single-stranded RNA virus with a positive meaning related to coronaviruses and arteriviruses. A closely related virus is gill-associated virus, GAV, which is the type species of the genus Ocarvirus. Receptivity. Yellowhead disease is a viral infection that affects shrimp, especially the giant tiger shrimp, Penaeus monodon, one of the two main farmed shrimp species. Penaeus merguiensis, Palaemon styliferus, and Metapenaeus ensis have been experimentally infected. Acute epizootic with high cumulative mortalities that can reach 100% within 3 to 5 days after the onset of clinical signs. The infection is horizontally transmitted. Postlarvae, PL, of tiger shrimp at stage 15 were resistant to infection, but PL stages 20 to 25 as well as juveniles growing up to young adults were found to be highly susceptible. Symptoms and lesions. The cephalothorax of infected shrimp turns yellow, the gills are white, yellow or brown, after an unusual period of intense feeding that ends abruptly. The then moribund shrimp clump together near the surface of the tanks before dying, within 2 to 4 days. Yellowhead disease was first reported in Thailand in 1990. The closely related GAV virus was discovered in 1995 during an outbreak related to yellowhead disease in Australian shrimp farms. The causative agent of yellowhead disease does not pose a risk to human health. The causes of the spread of yellowhead disease between crustaceans are: cannibalism, water contaminated by the virus. Humans can spread the virus by moving. Infected crustaceans, whether alive or dead. Contaminated equipment. Contaminated water. Diagnosis of yellowhead disease is done by laboratory analysis. Not all infected crustaceans will show clinical signs of the disease. At present, there is no treatment for yellowhead disease. Yellowhead disease in giant tiger shrimp. Look at the yellowed heads of infected shrimp on the left. The shrimp on the right are normal. Diagnosis. Suspicion, initially, increased diet, followed by a reduction in diet in later stages of the disease. Pale body, cephalothorax and hepatopancreas yellowish and swollen, gills whitish yellowish brownish. A presumptive diagnosis is made based on pond history, clinical signs, gross changes, and histopathology. Bioassay reinfection studies and transmission electron microscopy are used to make a definitive diagnosis. Preparations for the crushing technique identify characteristic abnormal hemocytes and connective tissue cells, with pycnotic and chioretic nuclei and basophilic cytoplasmic inclusions using right Giemsa-stained hemolymph preparations of gill squashes. Histology: massive systemic necrosis, with significant nuclear pycnosis and karyorrhexia, of numerous tissues, apparently of ectodermal and mesodermal origin, and, usually spherical, perinuclear basophilic cytoplasmic inclusions, hematoxylin and eosin staining, in at least some of the following tissues: systemic hemocytes and developing hemocytes in hematopoietic tissues and fixed phagocytes of the heart, matrix cells of the stroma of the lymphoid organ, ochre, lamellar epithelial pillars of Corti, spongy connective and connective tissues of gills, the subcuticular epidermis, cardiac and striated muscles, the ovarian capsule, nerve, focal, tissues, including nerve, neurosecretory and glial fiber cells, the walls of the stomach, middle intestine, and cecum of the middle intestine. The ochre organ, gills, heart, midgut and hepatopancreas usually contain a higher degree of yellowhead virus and appear to be the tissues and organs primarily targeted for infection with this virus. Cellular changes in early infections include nuclear hypertrophy, chromatin decrease and margination, and lateral nucleoli shifting. Hemocyte infiltration, aggregation, and encapsulation occur, but they are diffuse and not visible, unless a secondary bacterial infection occurs in parallel with the yellowhead virus. Electron microscopy, elongated enveloped virions, measuring 150 to 200 nanometers by 40 to 50 nanometers, consist of two structural units, the nucleocapsid and the envelope having a 3-layer membrane. Free virions were also present in the intercellular spaces. In addition, dark-stained cytoplasmic inclusions have been found in some cells. Bioassay, experimental studies investigating reinfection or transmission of the disease using juvenile 10-gram P. Molodon exposed to dilutions of filtered supernatants, 0.45 or 0.22 m, made with suspect shrimp gills or fed with suspect shrimp carcasses are an alternative diagnostic method. Typically, clinical signs develop within 24 to 72 hours, and up to 100% of mortalities occur within 3 to 5 days. Juvenile American penaeid shrimp, listed above, developed serious fatal systemic infections within 8 to 10 days of eating carcasses infected with the yellowhead virus. Immunoassay, monoclonal and polyclonal antibodies have been developed against yellowhead virus. Contact G. Nash for more details. Other research activities. Currently, there is no reliable crustacean tissue culture system or insect or fish cell lines to grow and isolate pathogenic viruses from penaeid shrimp. Much remains to be done in this area. Research is underway to try to develop a DNA probe. Control methods. No known treatment. Rapid detection and emergency harvesting, followed by thorough disinfection. Post-transporter status is not yet confirmed, but reducing stress by maintaining optimal rearing conditions and the pond environment can be helpful, by keeping phytoplankton blooms at a transparency of 25 to 35 centimeters and maintaining a stable pH in the pond. Once the shrimp are harvested, the accumulated organic matter and sediment must be removed, and the pond must be thoroughly prepared. Another method that is sometimes effective is to adopt a closed or semi-closed culture system, which restricts water supply flows and redirects treated water. Waterborne infection is possible, and cell-free viruses have been found virulent for up to 72 hours in water. Methods for disinfecting the water and eliminating any carriers before using them in the pond and before discharging them are being studied. Under laboratory conditions, chlorine between 20 and 30 parts per million is an effective disinfectant. Research is currently being carried out on the use of probiotics and immunostimulators. Research into vaccine development has just begun. Immune protection against yellowhead disease has been confirmed under laboratory conditions. Prevention. Selection of broodstock before hatchery stages, before storage in ponds, avoid rapid changes in water pH, alkalinity and dissolved O2, avoid fresh aquatic foods, deep cleaning of the pond bottom before storage, infected ponds and hatcheries must be disinfected. Infectious hypodermic and hematopoietic necrosis virus, runt deformity syndrome or RDS of P. VIRAEMIA. Etiology. Infectious hypodermic and hematopoietic necrosis virus is a small, single-stranded DNA parvovirus, mean diameter 22 nanometers. However, replication of this virus in the cytoplasm of the host cell has proven that the virus is in fact classified as picornaviruses. Geographical distribution. Enzootic in Taiwan, Singapore, Malaysia, Thailand, Indonesia, Australia and the Philippines, and probable enzootic also in Ecuador, Peru, and Central America. Believed to be introduced and now widely distributed in farmed penaeid shrimp from the southeastern United States, the Caribbean, Brazil, Hawaii, Guam, Tahiti, New Caledonia, and Israel. Host species. Considered extremely contagious and infectious in many penaeid shrimp, Penaeus stylirostris, Penaeus vannamei, Penaeus monodon, Penaeus chinensis, Penaeus occidentalis, Penaeus californiensis, Penaeus semisulcatus and hybrids of Penaeus monodon and Penaeus esculentus. Transmitted experimentally to Penaeus sativus, Penaeus japonicus, Penaeus aztecus and Penaeus durarum. Species such as Penaeus indicus and Penaeus merguiensis appear to be refractory to infectious hypodermic and hematopoietic necrosis virus. Impact on hosts. Reduced food consumption, cannibalism, increased mortality. In some cases, the shrimp gently rises to the surface repeatedly, turns over and sinks to the bottom. Particularly severe disease in juveniles in high-density tanks and rears in elongated tanks. Some members of the population surviving infection with the infectious hypodermic and hematopoietic necrosis virus or epizootics become apparently lifelong carriers of the virus and transmit it to their offspring and other populations through vertical and horizontal transmissions. Although the cumulative mortality rate from infectious hypodermic and hematopoietic necrosis virus is as high as 80 to 90% in post-larvae and juveniles, the etiological and economic significance remains unclear in Asia. Diagnostic. Suspicion: white or light beige spots in the cuticular epidermis, especially at the junction of the tentacle patches of the abdomen, which give the shrimp a speckled appearance. Confirmation. Histology: highly eosinophilic intranuclear inclusion bodies, hematoxylin and eosin staining of tissues preserved with acetic acid-containing fixing agents, variable to fulgin staining, depending on the stage of virogenesis and the amount of DNA present, in hypertrophied chromatin marginated nuclei from various ectodermal tissues, e.g., gills, epidermis, hypodermic epithelium of the esophagus and hindgut, nerve cord and nerve ganglion, and mesodermal, e.g., hematopoietic organs, gonads, antennal tubule epithelium, connective tissue of the mandibular organ, and striated muscle. Inclusion bodies are common during acute infections, and then decrease in number. This results in necrosis and infiltration of the target tissues by the hemocytes. Affected cells may also have a strongly vacuolated cytoplasm with cytoplasmic bodies ranging from eosinophils to basophils. Typically, the midgut cecums, and hepatopancreas, endodermal tissues derived, are not affected, except in severe cases where hepatopancreatic involvement has been observed. Electron microscopy: the virus is envelopeless, icosahedral, and has a cross-sectional diameter of 17 to 26 nanometers and 20 to 22 nanometers in purified preparations. Despite the nuclear involvement, the virus assembles and replicates in the cytoplasm of the host cell. Chromatin strands, visibly basophilic under light microscopy, are an important feature of the intranuclear inclusion bodies of the infectious hypodermic and hematopoietic necrosis virus. Virions can appear in paracrystalline clusters, which can be identified in histology as cytoplasmic bodies. DNA probes: many probes have been found, including BS4.5, which is specifically for infectious hypodermic and hematopoietic necrosis virus. These probes were developed in accurate and sensitive diagnostic assays based on in situ hybridization, on histological specimens and biopsy appendages fixed with Davidson's alcohol formaldehyde acetic acid, AFA, or preserved in formalin, spot hybridization, and polymerase chain reaction, used on hemolymph or tissue homogenates. Bioassay: expose a control shrimp, juvenile Pannaea stylirostris 0.1 to 4 grams, by cohabitation, feeding it with chopped carcasses or by injecting homogenates free of suspect shrimp cells. Control methods: no known treatment.